We're back with Thomas, who became famous for being the first man to give birth to a baby. But after having 3 kids, Thomas, like most new moms, wants to get his body back. So what are your complaints?
Well, I noticed that after giving birth to my 3rd child, that my lower abdomen kind of still looks like I'm pregnant sometimes, especially later in the evening. In the morning, it tends to be flat, but I can't control it. I can tighten up my muscles, but when I relax, it just kind of goes out.
And you used to be a bodybuilder before you...
I used to be a bodybuilder and an athlete.
Thomas, I have to say that like all women that go through pregnancy or anybody who's lost a lot of weight, you're going to be left with certain changes that will not go away with diet and exercise. And typically after pregnancy, it's loose skin, separation of the muscles, and you may have a little extra fat. Now, Thomas, I guess you went to see a doctor and the doctor told you that you may have a hernia, correct?
That's what he said. He said I probably need surgery to get it repaired.
And that's another common event after multiple pregnancies, big pregnancies, especially in smaller people. Not only do you develop that spreading of the muscles, but you may develop a small hernia, typically around the belly button as well. So why don't we take a look?
Can we show everyone what you're dealing with?
Examination.
Sure. All right.
And,
well, how about if you just pull your shirt up a little bit, and I'm going to help hold up while Dr. Worden examines you.
Okay.
Can you push it out? You see that? You see when he's in that sit-up position, do you see that? That is a classic diastasis recti. He has that defect in the fascia.
Is it okay if Julian?
Yeah.
I just for some reason have this feeling that it might hurt, because hernias hurt, right?
Well, this is not a true hernia.
Hernias only hurt if they
But you feel the edge of his muscle?
Yeah.
The tone is excellent, but then you fall right off into that.
This is very common, though.
Yes.
In many, many pregnant women, that separation of the abs.
At the same time, there is a small ring, an opening around the umbilicus, the belly button. So you do have a small umbilical hernia that we would correct at the same time during the course of a tummy tuck. So for you, Thomas, and everybody out there, take a look how we do a tummy tuck. We make an incision, typically the lower abdomen, like an extended C-section. We raise an abdominal flap. There you see that muscle. Those are the sutures that we place to bring that muscle back together again. We don't cut the muscles. So there's very little pain associated with what we do on the muscles. Remove that excess skin, bring the belly button back out in its original position, and voila, there's your tummy tuck, and we could fix that small hernia at the same time.
In Hernias 101 for everyone watching, if there's a small defect in your abdominal musculature, literally the contents of your intestine can poke out of that defect in your abdominal wall, and that's what a hernia is. If you can push it back in, that's called a reducible hernia. That's a non-medical emergency. But sometimes these hernias will come out, get trapped, and become strangulated and incarcerated where even the doctor can't get it back in. That becomes a medical emergency where you need a surgical operation right then and there. That's why you want to get this fixed for a number of different reasons.
He does. Even though it's small, he wants to do that. And talking about tummy tuck, for all women, you want to make sure that you're done having babies. You wouldn't want to have this procedure done. Yes, fix the hernia, but the rest of it you would wait if you thought that there was a chance that you're having any more kids.